Hey everyone, this is me Arzu and I welcome you to my channel Mr. Teeth. As I have discussed with the part 1 video of introduction to the dental anatomy in my previous video, so today I will be dealing with the part 2 of this chapter. In this chapter of introduction to the dental anatomy, we have total 10 topics to be covered, in which I have covered 7 topics in my first video of this chapter, and today I will be dealing with the remaining 3 topics of this chapter. So I request you everyone to watch first of all the part 1 video of this introduction to the dental anatomy. After that you can watch this video so that you can easily relate both the videos of this chapter. So without delaying much, I just want to start this chapter. So our first topic that should be covered, that is to be covered in this video, is division into the third. So I think this topic is extremely easy to understand. I will teach this topic by showing you some pictures. I will take some few minutes. Okay, so I think this is visible here. Okay, it is visible. So as we can see here, in division of thirds, in division into the thirds, we divide the tooth by drawing 2 vertical lines and 2 horizontal lines. Okay, due to division by 2 vertical and horizontal line, it gives 3 different parts. Okay, so in the crown, as we can see here, we have 2 horizontal lines. We have 2 horizontal lines dividing the crown, okay, into incisal, middle and cervical third. Okay, similarly in crown itself, it is divided by 2 other vertical line, and they form mesial and distal along with the middle portion. I have discussed previously in my part 1 video that mesial is that surface, that part of the tooth that is facing towards the midline of the dental arch. Similarly, the distal part is that part of the tooth that is facing away from the midline of the dental arch. So it is easy to understand. Similarly, in root also we divide by 2 horizontal lines and forming cervical, middle and apical third. Okay, while pronouncing, we just pronounce incisal third, middle third, cervical third. Similarly, we pronounce cervical third, middle third, apical third. Okay, similarly in a posterior teeth, we can see here we are dividing with the 2 horizontal lines into the occlusal third, middle third and cervical third. Similarly, by 2 vertical lines, it divides the tooth into mesial, middle and distal part. Okay, similarly in the root also, similar to this anterior tooth, we have cervical third, middle third and apical third. Okay, by looking the teeth proximally, we can see here the teeth that is facing towards the buccinator muscle is buccal side, and the part of the tooth that is facing towards the tongue side, it is a lingual side. Okay, so I have discussed in previous video that where do you use lingual side and where do we use palatal side. Okay, similarly proximal view of the crown, we can see here there is a labial side, another is a lingual side, and in between these two there is a middle portion. Okay, so I think this topic is easy to understand, and it is also a fundamental topic that every dentist and dental students should know. Okay, so let's move to our another topic, and our another topic is line angles and the point angles. Okay, so most of us wonder that this topic we have read in our preclinical conservative subject. As in preclinical conservative subject, there is a chapter that is called fundamentals of tooth preparation. In that chapter, we used to study about the line angles and the point angles. There what we have studied is that line angle is the angle that is formed by the junction of 2 planar surface. Okay, junction of the 2 planar surface. So here I want to explain you that just imagine that this is one plane, this is another plane. Okay, so the angle between these 2 planar surface junction. Okay, So this junction is called line angle. Similarly, the point angle is that angle that is formed by the junction of three planes. So let's imagine this is these three plane are in okay, these three plane are in three plane. So the angle between this, that is junction between this, sorry, the junction between these three plane is a point angle. Okay, so it is a similar here also as we study in conservatives. So as I have written here, normally no any angles or point are formed on the teeth, means that it tells us that normally in a natural teeth there is no presence of there is the absence of any kind of angles or a point in a tooth. But during cavity preparation or during tooth wear, like atresion and abrasion, so we should remember just two things, that is exception is wear tooth and another tooth preparation. Okay, so now let's discuss with the line angle. Okay, so in line angle we can see here I have written this is a junction between the two planar surfaces. Okay, one two planar junction between the two planar surfaces. So first of all, let's discuss about the line angles of anterior teeth, then after we will move towards the posterior teeth. Okay, so in anterior teeth there are 6 line angles. Okay, so in 6 line angle, the names of those line angles are mesiolabial, distolabial, similarly mesiolingual, distolingual, labioincisal and linguoincisal. So I have written in a way that it will be easy to remember. So mesiolabial, distolabial, mesiolingual, distolingual, labioincisal and linguoincisal. Okay, so I have written here note is that mesioincisal and distoincisal line angles are rounded. Okay, so we may wonder that there is also presence of mesioincisal, okay, and distoincisal line, but in anterior tooth those line angles are quite rounded. Okay, so we consider they as they are not a angle. Okay, just we omit them, or just we do not consider them. Okay, similarly in our posterior teeth we have 8 line angles. They are mesiobuccal, distobuccal, mesiolingual, distolingual, similarly mesoocclusal, distoocclusal, bucco-occlusal, linguo-occlusal. Okay, so I will explain this again by showing one picture. Okay, so let's see here. Okay, it's visible. Okay, so this is anterior teeth and we are looking here line angles of the anterior teeth and posterior teeth. So in anterior teeth we can see here this is a labioincisal line angle. Okay, similarly back side of that there is a linguoincisal line angle that is dotted. Okay, similarly in the distal side there is a in distal side there is a distolabial line angle, distolingual line angle. Similarly medial side there is mesiolabial line angle and mesiolingual line angles. Okay, similarly in a posterior teeth it is easy to remember this. Okay, this question can be asked in our viva, so prepare it too. Here we can see that there is a distobuccal line angle and mesiobuccal line angle, similarly distolingual line angle, and backside it there is a dotted line that is backside is that is a distolingual and that is a mesiolingual line angle. Okay, so similarly this this planar surface and occlusal surface forms again another line angle, that is this is a distal side. Okay, so distal side and upper portion is occlusal surface, so this is a disto-occluso line angle. Okay, similarly we can say for all other 3 surfaces. So total there are 8 line angles in posterior teeth, and in anterior teeth there are 6 line angles. Okay, similarly now when we go to the point angle, so for point angle also I will show you on this picture, it will be clear. Okay, so here also we can see that mesiolabioincisal point angle means mesial side, labial side and incisal side are meeting at a point. Similarly mesiolinguoincisal point angle, that is just behind of this point angle, mesiolabioincisal angle. Okay, so in mesiolinguoincisal point angle there is a meeting point of mesial side, lingual side and incisal side. Similarly for the distolabial and distolingual it is easy to understand. Similarly in a posterior teeth we can also see here mesiolinguo-occlusal point angle, mesiobucco-occlusal point angle. Okay, so this is a mesiobuccal-occlusal mesio-bucco-occlusal point angle, means their mesial side from this, occlusal side from this, and buccal side from this. So three surfaces are meeting at mesio-bucco-occlusal point angle. So it is easy to understand. Okay, so after completing these line angles and point angles, now I will move towards the important topic of today's video, that is important landmarks. Okay, so in important landmarks, as we can see here, landmarks, I have divided those landmarks in two groups. So the first group is of elevations. Okay, so this first group is of elevations, and this group is of depressions. Okay, so we divide landmarks in two particular groups. One is elevations, another is depressions. Okay, so in elevation, we can see there we have five important line angles. Okay, they are cusps, they are cingulum, they are tubercle, ridge, lobes. Okay, similarly in depression we also have further four landmarks. They are fossa, sulcus, groove, and pit. Okay, so ridge, it is further divided into the six other types of divided. Term is not suitable here, I think. So they are actually the types of the ridge. Okay, so one is buccal ridge, another is marginal ridge, another is triangular ridge, incisal ridge, transverse ridge, and oblique ridge. Okay, similarly in fossa also we have two different kinds of fossa, triangular fossa and the lingual fossa. So we will be dealing with all those landmarks. Okay, now itself. Okay, so as we can see here, first landmark is our cusp. Okay, so we will be dealing with the cusp first of all. So actually cusp means what it is. It is simply a elevation or a mound on a crown portion. Okay, it is elevation or a mound on a crown portion. It makes up a divisional part of a occlusal surface. Okay, so this statement wants to tell us that it actually cusp actually divides the occlusal surface. Okay, it forms the different kinds of divisional parts of the occlusal surface. Similarly, they are named as per their location. Similarly, I have mentioned here in premolars we have actually 2 to 3 cusp, and in molars we have 4 to 5 cusp. In our further videos we will be discussing with the anatomy of each tooth. There this statement will be clear. For now I want to say that in premolars we have actually 2 cusp. Okay, in all maxillary first premolar, maxillary second premolar, mandibular first premolar we have just 2 cusp, and in mandibular second premolar we have a 3 cusp. Okay, similarly in molar, in maxillary first molar we have 4 cusp, and in mandibular first molar we have 5 cusp. Okay, so now moving ahead, there is a cingulum. So in Latin, cingulum is called as girdle. Okay, cingulum means girdle in Latin. Okay, so it forms the lingual lobe of the anterior teeth. Okay, so cingulum is mostly present in our anterior teeth. When we this part of the tooth can be felt easily by our tongue. Okay, so there we can feel that at a cervical portion of the anterior teeth there is a small elevation that is called cingulum. Similarly, it forms the bulk of the cervical third of the lingual surface of the anterior teeth. Okay, it is also easy to understand. Similarly, it resembles like the girdle encircling the lingual surface of the cervical third. Okay, lingual surface at the cervical third. So it forms a girdle like structure. Okay, it forms a girdle like structure at the lingual surface of the cervical third. Similarly, moving ahead we will study about the tubercle. So tubercle is not it is not anything, just it is a smaller elevation on the crown that is produced due to the extra formation of the enamel. So during the mineralization of the enamel, when the enamel matrix are mineralized by the mineral components, okay, so at that time there may be formation of the smaller elevations on the crown. So those elevations are defined as a tubercle. So it is easy to understand. Now moving ahead, we have another topic, that is another landmark that is ridge. Okay, so this is important, I think. Okay, So ridge means it is a linear elevation on the surface of the tooth. Okay, so it is a linear elevation on the surface of the tooth. We have 6 different types of the ridge as I have discussed earlier. So first type of the ridge is buccal ridge. So buccal ridge is present on as the name suggests us that it must be present on a buccal surface. So I have written here example, but it is present in other tooth too. Okay, so in maxillary canine we have prominent buccal ridge. Okay, so it is present in a buccal surface. Similarly, our second ridge is marginal ridge. Okay, so marginal ridge is present at the margins of the lingual surface in anterior teeth and occlusal surface in posterior teeth. Okay, so it is in anterior teeth and this is in a posterior teeth. Okay, this is in a posterior. Similarly, okay, so as here written, they are the rounded borders of the enamel forming mesial and distal margins of the premolars and the molars. Okay, similarly in another point we can see here, they form the mesial and distal margin of the lingual surface of the incisor and canal. So marginal ridge is nothing but it is just a ridge that is present at the margins of the tooth. Okay, in posterior teeth we can see this at the occlusal surface. Okay, but in anterior teeth we see those ridges in the lingual surface. Similarly, moving to the another ridge, we have a triangular ridge. Okay, so in triangular ridge it descends from the it is a ridge that descends from the cusp tip of the molars and the premolars towards the central part of the occlusal surface. Okay, so in our tooth surface, as we can see, this is let's think that it is a maxillary occlusal surface of the maxillary first molar. So in this we can see that if this is a cusp, okay, so from the cusp in a central portion, this is a central portion of the occlusal surface of the maxillary first molar. So from the cusp tip to the central portion of the maxillary occlusal surface of the maxillary first molar, the ridge, there is a presence of ridge. So this ridge is called triangular ridge. Okay, they are named so because a slope of each side of the ridge resembles the two sides of the triangle. So just imagine, okay, this is our cusp tip. Okay, and this is our triangular ridge. So okay, so this is our cusp tip, this is our cusp tip, and this is our triangular ridge. So we can see that the sloping of this ridge will form a triangular like structure at both the side. Okay, so they are called triangular ridge. Okay, okay, so I have written example 2. So triangular ridge of the buccal cusp of the molars. Okay, so this example is not required after you understand this concept. Similarly, after our another ridge is incisal ridge. Okay, so it is easy to understand. It is present in anterior teeth. Okay, at the incisal portion of the anterior teeth. Okay, similarly, now our another ridge is transverse ridge, that is a union of the two triangular ridge, that is buccal and the lingual ridge. Okay, so I will show here. Similarly, just imagine that this is another cusp and this is our another cusp. So a triangular ridge coming from this side and the triangular ridge coming from the this side. Okay, so they both the ridge they meet. Okay, so they both the ridges are meeting at the central surface. So collectively these two triangular ridges are called transverse ridge. Okay, okay, it will be more clear when I will show you the pictures. Okay, now I will talk about the oblique ridge. So oblique ridge is very important. I think this can be asked in your viva and also in your theory exams. So in oblique ridge, obliquely, so the name clears that it crosses obliquely the occlusal surface of the maxillary first molar. Okay, so in maxillary first molar there is formation of the maxillary first molar. There is a presence of the oblique ridge that is formed by the triangular ridge of the distobuccal cusp and the distal cusp ridge of the mesiolingual cusp. Okay, so So this oblique ridge is formed by the triangular ridge of distobuccal cusp and the distal cusp ridge, okay, distal cusp ridge of the mesolingual cusp, okay. So I will show you picture. And this is a very important statement. I think they can ask you in viva. So how the oblique ridge is formed in maxillary first molar, and then at the time you can say that it is formed by the triangular ridge of the distobuccal cusp and the distal cusp ridge of the mesolingual cusp, okay. Similarly, now I will discuss with the lobes, okay. So in the lobes we can see here, I have written, it is a primary section of the formation in the development of the crown, okay. So the primary sections, they fuse, okay, during the development. Cusp and mamelons are collectively called lobes, okay. So they are representative of the lobes, like, okay. So now mamelon is one of the three rounded protuberance in incisal third, okay, of the anterior teeth, especially in a central incisor. I will show you the picture of mamelon. So this is important. Mamelon, they can ask you in viva what are mamelons. So at that time you can say that they are the rounded protuberance that arise at the incisal portion of the anterior teeth, especially incisors, central incisors and lateral incisors. Similarly, I have written here in premolars, there are okay, total 4 lobes, okay. So in maxillary first and second premolar, and also in mandibular first premolar, there are 4 lobes, 3 in buccal side and 1 in lingual side. Similarly, in mandibular second premolar, there is addition of 1 more lobe, so it forms total 5 lobe, so 3 on buccal side and 2 on lingual side. Similarly, in the molars we can see both the maxillary and mandibular, there are total 5 lobes, okay. So it is to be remembered by you all. I think this is important also. So now we will move to the depressions, okay, landmarks that are coming under the group of depressions. So in depression we see there, our first heading is fossa. So fossa means it is a irregular depression or a concavity also we can say, okay, or a concavity we can say, formed by the convergence of the ridges at the central point, okay. So it is a depressions or the irregular depressions that are formed by the convergence of the ridge, okay. So there are 2 fossa, one is triangular fossa, another is a lingual fossa. So in a triangular fossa, as I have written here, occlusal surface of the molars and the premolars constitute of the triangular fossa, and the mesial or the distal to the marginal ridge. So I want to show you here. So again I will draw occlusal surface of the maxillary first premolar, okay. It seems like a heart, but it is occlusal surface of the maxillary first molar. So just imagine here that this is a central groove, okay, that is running on the in the center of the occlusal surface of the maxillary first molar. So the developmental groove runs like this, okay, similarly runs like this, okay. So at this point we can feel a fossa is formed, okay. So at this point there is formation of the fossa, and that is triangular in shape, so we tell they are triangular fossa, okay. Similarly, and they are mesial or distal to the marginal ridge. Similarly, if I take this as a mesial and this as a distal, so this is a mesial marginal ridge, and so it is distal to the mesial marginal ridge, and this triangular fossa is mesial to the distal marginal ridge, okay. So it is, while talking it is quite confusing, but it is easy to understand. Similarly, in the lingual fossa also, they are present in an anterior teeth, and they are surrounded by the incisal ridge at the upper portion, okay. So this is a cingulum, I think, okay. Let's take it as a cingulum, and this is as a lingual fossa. So lingual fossa is surrounded in upper apical portion by a incisal ridge, and in the mesial side by the mesial marginal ridge, and in distal side by the distal marginal ridge, and at the lower portion it is surrounded by the cingulum, okay. So it is clear, I think. Now I will move to the sulcus. So sulcus is a long depression or the valley between the ridge and the cusp of the tooth, okay. So I have written example, central sulcus on occlusal surface of the molar, okay. So sulcus are actually a long depressions, and the grooves are the narrow and shallow depressions between the primary part of the tooth. Grooves comes under the sulcus. Okay, so sulcus usually contain those grooves. Sulcus are okay, just imagine, as I have okay, so they both are the okay, they both are the sloping of the cusp. Okay, sloping of the cusp. So, and this is a one lobe and this is another lobe, so we can see here that the junction between those, there is a formation of the groove. Okay, so that groove we called as a developmental groove, and this large fossa is present here. Okay, so this large depression that is present here, which is v shaped in cross section, that we call it is a sulcus. So that is a main difference between the sulcus and the groove. Many of us don't know this. We just think that sulcus and groove are usually similar. Okay, but they are not so. Sulcus are the v-shaped cross section having a larger depressions, larger valley. Okay, they are the larger depression, but groove are the smaller depression. Okay, they are the smaller. Okay, they are just like a line. Okay, they are the shallow depression. So in groove also we can see here there are two types of groove. One is primary developmental groove and another is a supplemental developmental groove. So primary developmental groove, it marks the junction of the primary parts. Similarly, the supplemental developmental groove means they are supplemental to the primary developmental groove and they doesn't mark the junction. Usually the supplemental developmental groove, it arises from the primary developmental group. Okay, I will show you in pictures. So I have written the difference here between the sulcus and the group, and this is important. Sometimes they can ask you in a viva. So as I have written here, the features in this column, sulcus and group. Okay, so shape, usually sulcus are broad and they are V-shaped depression. They are narrow and shallow linear depressions. Okay, similarly here we can see that it is a location. They are between the ridge and the cusp. They are along the lines of the lobe where coalesces. So as I have told here, when the lines, okay, so when the lines of both the cusp coalesce, that forms the groove. Similarly here it contains the developmental groove. Sulcus usually contain the groove and it is present in a sulcus. Example is central sulcus. Okay, so central sulcus is present at the central portion of the tooth. Similarly central groove and the buccal groove. Okay, and our last heading that to be discussed today is that is pit. Okay, so pit are the small pinpoint depressions at the junctions of the groove. Okay, so when both the groups, okay, they come and meet at a point, these points are called pit. Okay, they are the small pinpoint like depressions at the junction of the groove. Now it will be more clear when I will show you the picture. So just give me a few minutes. So in this first picture I can show you the mamelons. Okay, that are here we can see they are the mamelons. So this rounded protuberance, this rounded protuberance and this rounded protuberance, they are the mamelons in incisor teeth. Okay, usually when we see the teeth of the baby, okay, usually in teeth of the baby we can easily feel this protuberance, rounded protuberance at the incisal teeth, incisal third of the tooth. Okay, so okay, so let's first study this diagram. So we can see here this is taken from the Wheelers, and we can see here, okay, so this is a maxillary first molar. Okay, so BCR means buccocervical ridge. Okay, so it is a ridge, buccocervical ridge. Buccocervical ridge means in the buccal side, but in a cervical portion there is a elevated like structure, that is buccocervical ridge. Similarly BG, that is buccal groove. Buccal groove means it is a groove and that is running between the two cusp of the buccal side of the maxillary first molar. Similarly we can see here the central fossa. Central fossa means okay, central fossa, this is this circular pattern. Okay, this circular pattern, this is a large area. Okay, so that large area, this is a three-dimensional area. Okay, that area is called central fossa. Okay, so here we can see the distobuccal cusp. Okay, DBC. So distobuccal cusp is present here. Distobuccal cusp, okay, it is visible I think in photo. Okay, so it is visible. So distobuccal cusp means it is naming the cusp. Okay, similarly we can see here DG means distal developmental group. Okay, so simply it is a developmental group. Okay, now DLC means distal lingual cusp. Okay, DLC means distal lingual cusp, naming the cusp. DMR means distal marginal ridge. Okay, DMR means distal marginal ridge. This ridge that is in the distal side of the tooth, it is called distal marginal ridge. Okay, and MBC means mesobuccal cusp. MBC means mesobuccal cusp, naming the cusp. MLC means mesolingual cusp. Okay, so as I have told earlier, oblique ridge runs between the mesolingual cusp and the distobuccal. Okay, distobuccal cusp, this is a oblique ridge. Okay, that is a characteristic feature of the maxillary first molar. Similarly OR means oblique ridge. Okay, oblique ridge that is running between the two cusps. Similarly MLC oblique ridge. Okay, supplemental group. Supplemental group, okay, it will not be more clear, but when we will see the model of the tooth, there it is easily visible. Supplemental group are the small groups. Okay, they are just running from the central, running from the primary developmental group. Okay, they are supplemental development, they are not at the junctions of the primary developmental parts. Similarly the triangular fossa TF. Okay, so as I have told, it is at the mesial side or the distal side of the marginal ridges. Okay, so this photo is clear. Okay, so in this anterior teeth also, let's see, this is a CL. Okay, so CL means cervical line, that is denoting between the crown and the root. Similarly this CI means cingulum. Okay, it is representing the cingulum. Similarly this is marginal ridges. Okay, marginal ridges, this is a distal marginal ridge and this is a mesial marginal ridge. How I came to know this, how I came to know this is that in a central incisor in mesial side there is a sharp angle. Okay, but in the distal side there is a blunted angle. Okay, similarly this is a lingual fossa, and this is a incisor ridge. So this tooth anatomy we will be discussing in further videos in a clear cut manner, so you guys can easily remember from those videos. So don't take tension now. So as I have completed both the parts of this topic, introduction to the dental anatomy, and this the things that I have discussed in both the part of this chapter are extremely important. Okay, so don't take those topics so lightly, just go through it as I have discussed properly in a video. So after looking a video, I will post the note of this video in my Telegram channel. Okay, so you can get from that too. So during the preparation of the videos, my main motto is to contain all the content, okay, that are required for board exams or different competitive exams. So I prepare this content by especially the wheelers, but also I used to look other books too. So just go through those video, I think they are more than enough. So if you have liked this video, the content of this video, then please do like this video, subscribe to our channel, and share this video with your batchmates so that they too can see this video and get the knowledge.